Effective Friday at 5 p.m., we will be executing a stay-at-home order for Guilford County through April 16th.
All right, it's been exactly 3 years since we heard that the day that Guilford County residents and most really of the Piedmont were ordered to just simply stay home. It was the first big step to stop COVID-19 from spreading at a time when vaccines were still months and months away. Today, things look very different. Normal life has resumed for many. COVID numbers are trending in the right direction. The number of statewide cases has dropped. Hospitalizations and transmission rates are also going down. So what can we do to keep it that way? And what is changing that is making things even more normal than what we've seen? That's our focus in today's To Your Wellbeing segment. Dr. Cynthia Snider, Infection Prevention Medical Director at Cone Health, is joining us. All right, so first let's just talk about numbers because we like to, have the foundation of the data. How are the numbers now compared to just a few months ago?
So they are definitely much improved. Like every week, we're seeing easily 10 to 20% decline in cases, and especially within hospitalized patients. And so across the state, we're seeing that transmission level going from exceedingly high down to like moderate, but we anticipate that to continue to go down further.
Okay, and I'm sure you would say this does not mean that you don't have to worry about COVID anymore, but we can worry about it maybe in a different way than we did before.
Correct. Even if you think of us of where we were 6 months ago, we know that many people have had immunity from the vaccine or natural immunity from catching COVID once or maybe twice or more, or even the combination of both. And so we really feel that essentially that herd immunity, the immunity in the community is much higher than it has ever been. And the fact that the cases are low, so we feel that it is safe to go into a different phase of this pandemic, and it's more kind of this endemic phase, and we feel that masking can be optional.
All right, yeah, let's talk about that because this is the big news from today. Many area health systems, including Cone Health, are moving to optional masks starting tomorrow. So what does that mean for the patients, for the visitors, and all of that?
Right, so we are stepping away from universal masking, and we're giving that choice up to patients, visitors, and staff members. However, there is some responsibility to the patient and the visitor and the staff member. So, anybody that's been exposed to COVID or has any symptoms concerning for COVID, we still want you to wear a mask. Patients that are immunocompromised, be it with cancer or other disease processes, we are still masking around those folks. And the key thing too is that we're not saying forget it, like everything that we've learned in the last 3 years doesn't mean anything. It still does. We still want people to get vaccinated. We know that a lot of people are asking us, I'm like, should I get the vaccine booster? I'm like, if you have not had that bivalent vaccine, this is a great time to get it. If you have any symptoms, don't come visit your friends, because we got to know what those symptoms are about. You still should get tested for COVID illness.
Mm-hmm. With the lower transition rates and masks becoming optional in most healthcare settings starting tomorrow, I mean, some people may think that the vaccinations and boosters aren't needed anymore, but that is not the message that you're sending.
Correct. We want everybody to be responsible, knowing that we're giving folks options because we feel it is safe to go under to being mask optional, but also we want people to be very, very respectful of those that still choose to wear a mask, be it for personal reasons, for if they've had exposure, or just right now, not everybody is ready to completely abandon the mask.
Yeah, and if you want to wear the mask, that's okay.
Exactly.
Okay. Is there anything else that we should be doing to make sure that these numbers stay in the right direction?
So I think just the key thing is that, it does sound like a broken record. We always are a big fan of getting the vaccine booster. We will find out, I bet you, over the month's time what that means in the fall if another booster vaccine is required. But for the time being, we're really knowing that not many people have received the most recent bivalent, that's the choice to go to. If you're going to be in a crowded area with poor ventilation and you may be at risk for severe disease, that should be a recommendation to wear a mask at that time.
All right, so Easter gatherings, spring break, all this stuff is coming up within the next couple of weeks. How concerned are we with seeing those numbers creep back up just because of that event?
Yeah, I don't doubt that some numbers will bounce back up a touch, but what I'm hoping is that, with the current trend that, a lot of people have immunity from the latest strain. So many people who even avoided getting COVID those first couple of years ended up getting the most recent strain because it was so transmissible. So we suspect that still people are quite protected from that. And another way also to boost that immune level is to get that vaccine.
All right, and if you're traveling over spring break, I'm guessing what you were just talking about, like, hey, mask up if you're going to be in a crowded space. So, if you're traveling by airplane, probably not a bad idea.
Correct. I'm a big fan of wearing. We know that transmission has occurred on planes, and so being able to wear a well-fitting mask while you're on the airplane makes the best sense.
All right, and should we be testing ourselves before traveling?
I would say if you are starting to have symptoms, it makes sense to get tested. And if you feel like you've had exposure to COVID and are in that, between that day 5, day 7 period, you can use the antigen test to get tested, or a PCR test to get tested as well at that time.
Okay, and if someone does get COVID-19, let's just kind of regroup. What should they do to prevent others from getting it, and what should they be doing? Like, how long should they be staying at home?
So that part of the message has not changed. Anybody who's had COVID, you need to isolate yourself from your family members. Do not come to work. At least stay home for 5 days. And then if you're going back to work, even if your workplace is mask optional, you need to be wearing a mask to finish out that 10 days of isolation.